Hi, are you having a hard time to decide which breast reconstruction is right for you? When I was undergoing active treatment, and especially when I was just freshly diagnosed, I was just so overwhelmed and I felt that the breast reconstruction part was just not that important to me. All I wanted was to have the breast cancer out. So I didn't really look at all of my reconstruction options, and neither did it cross my mind to consult with several plastic surgeons. Like a lot of other survivors will tell you as well, you might then end up with the reconstruction option that your plastic surgeon is the most comfortable with, which a lot of times it is still implants. However, that is not necessarily what you want. Once my active treatment was over, I started to explore all of my options, and I started to list the pros and the cons of a implant-based reconstruction versus a reconstruction with my own tissue. I had then decided to have a prophylactic other side mastectomy and have my expander explanted and have a reconstruction on both sides with my own tissue. It took me a long time to decide, and it was quite challenging to find the right plastic surgeon. With my story, I don't want to sway you in one way or the other. However, I want to strongly encourage you to explore all of your options and consult with several plastic surgeons. By sharing the steps that I took, I hope I can inspire you now to make the decision that is right for you. First, I made a list of all the pros and cons of an implant-based reconstruction versus a reconstruction with my own tissue. I had made that list based on consults with 6 different plastic surgeons and talking to other survivors. You can find that list as well in one of my blog posts. 2. Based on my own preferences and looking at the pros and the cons of each reconstruction type, I had decided that I wanted a reconstruction with my own tissue. My own preferences were that my breast should look and feel as natural as possible. Also, I didn't like the upkeep that came with implants. I didn't want to undergo any more future surgeries, even if that meant that now I had to undergo a longer surgery and the recovery would be slightly longer. I didn't like either that breast implants carry the risk of infection, breast implant illness, and capsular contracture. That a reconstruction with my own tissue could potentially also help with my lymphedema was an added bonus, because that could absolutely improve my quality of life. 3. Now I actually had to find out if it was possible to have a reconstruction with my own tissue. It was quite challenging for me to find the right plastic surgeon, especially since all the plastic surgeons that I had consulted so far, they were all telling me that I was not a candidate for a reconstruction with my own tissue simply because I didn't have enough body fat to reconstruct 2 breasts. It was not until I found this one surgeon who used a flap that is a little bit less commonly used. However, he did a lot of reconstructions on women with similar build just as mine, and he was using the upper buttock flap. 4. I then wanted to know how many of these surgeries with this less common use flap the surgeon actually was doing. And he was doing more than 100 a year for several years already. I then also wanted to connect to some of his patients and see before and after pictures. I connected to them and I was talking to them to find out what their experience was and how happy they were with the result. All these women I had talked to had a similar build like mine, so it gave me a good picture to imagine how I would look like. And it convinced me that was the way that I wanted to go. There was one more hurdle though. It meant that we had to change insurance, and that surgeon was also out of network. 5. I now had to weigh the extra weight the extra money, and the slightly longer recovery for a body that I had to be comfortable with the rest of my life. At this point, my decision was made. Your decision might look completely different than mine. However, I strongly want to encourage you, and I wanted to show you with my example how important it is to know all of your options and to not get discouraged after a consult with just one plastic surgeon.